SMILE has been there for more than decades. Still many surgeons and young ophthalmologists willing to go into it, but they hasn't started yet. So this is an introduction for an easy and safe start. SMILE hypermetropia treatment awaits CE approval. Therefore, SMILE is indicated where LASIK is indicated for myopic patients. SMILE affects the corneal biomechanics less than LASIK. However, we still can't exactly interpret biomechanics results in practice. Hence, in cases where PLK is indicated and LASIK is not due to risk of ectasia, SMILE is contraindicated too. There are many advantages for SMILE, including the capacity to do high myopia up to -10 diopters, and it causes less dry eye than LASIK. I'm going to show you a video of SMILE procedure. This is of a 22-year-old male, right eye, -4.5. So we start with docking, centration, active, the suction, and check centration with the infrared. Start the laser from the posterior lenticule, cut from peripheral to center, and then the side cut of the lenticule, and then the anterior cut, anterior lenticule, or the cap cut, and extends over the edge to create the corridor, which is useful for manipulation, and at the end, the incision at the bottom. Now, the second step would be plane identification and dissection. We go with the short spatula in the posterior plane. The bubbles and difficulty entering is a good indication that we're in the right plane. And then we use the large or long spatula. We go into the corridor, cross over the edge of the lenticule. We lift up the spatula while we do that. And then we do sectional dissection. I tend to avoid using forceps to hold the eye during the procedure. Many do use it. And this is a 4mm section suitable for beginners. I advise that you go down to 2mm later on with the right instruments. Now we go to the posterior plane. We go all over the way to the other side of the lenticule, and then we dissect again across the edge all over, but we leave 2 anchors on the right and the left till the end. So this is the first anchor on the left. We lift it, and then we go crossing all over the edge, all over the lenticule. And then this is the little anchor on the right, dissected. After that, we go back to the anchor on the left. That's it, really. Then we go to the next step, which is lenticule removal. We use the designated forceps, and we go in above and below the lenticule, catch it, remove it. I always check if the lenticule is complete, and I do massage on the cornea to oppose the surface as well. There are a few tips that are given to SMILE beginners. One of them is to use a small size indentation cone, which is associated with less laser duration and less suction loss. So I worked on the settings and came up with these settings, which allow small size indentation cone for all cases with pupil mesopic size less than 6.5mm. This provides a laser duration of 24 seconds. Another tip would be avoiding myopes less than 3 diopters at the beginning, because the lenticule will be very thin and challenging to dissect. Originally, machine designers increased the optically necessary lenticule thickness to facilitate its manipulation and removal. You can see the top figure, that's the optically necessary lenticule. And the bottom one shows the added thickness. However, in low myopia, in less than 3, the thickness will be less than 30 microns. In -1, it'll be 17 micron, which is very challenging to dissect. So I worked again on the settings and came up with this, with the thickened lenticule, about 50 micron, and still we can use the small cone to have less suction loss. These settings and more, including lenticle thickness calculator for SMILE VISUMAX and RSP calculator for SMILE VISUMAX and LASIK ML90, available at a smartphone-free app, which will be launched soon by the GCAO group, which is a non-profit volunteer group. Thank you very much indeed.